Obsessive-compulsive disorder, OCD, is a mental health condition where a person has obsessive thoughts and compulsive behavior. An obsession is an unwanted, unpleasant thought, image, or urge that repeatedly enters a person's mind, causing them anxiety. The word obsession usually describes something enjoyable, but in OCD, the obsession is unpleasant and frightening. A compulsion is a repetitive behavior or mental act that someone feels they need to carry out to try to prevent an obsession coming true. For example, someone who is obsessively scared they will catch a disease may feel the need to have a shower every time they use a toilet. Everyone double-checks things for some times. For example, you might double-check to make sure the stove or iron is turned off before leaving the house. But people with obsessive-compulsive disorder, OCD, feel the need to check things repeatedly, and rituals associated with OCD cause distress and get in the way of daily life for many people. OCD starts during childhood or the teen years. Most people are diagnosed by about age 19. Symptoms of OCD may come and go and be better or worse at different times.
18-1 Definition. Obsessive-compulsive disorder is an spectrum including anxiety and including disturbance of thoughts and disturbance of emotions. We have several types of obsessive-compulsive disorders. Some obsessive-compulsive disorders related to watching, accounting, or saving and hoarding, saving something that not use or less use, or shopping for females, over shopping and overthinking in a lot of things. Another type of obsessive-compulsive disorder related to sexual thoughts and homosexuality, by the way, obsessive thoughts. Another thing related to obsessive-compulsive thoughts related to religion and the prayer.
When you have obsessive-compulsive disorder, it's shortened typically to what you would call OCD. You feel compelled to do certain activities, and if you don't complete those activities, you would feel extremely anxious and concerned inside that you hadn't fulfilled those. Your reason for doing that is you feel that something perhaps bad might happen, or some other thing that might happen that you think is related to the activities that you're doing.
The diagnostic features for the disorder involves the presence of either a obsession or a compulsion in the individual having the disorder, with associated with functional impairment. Now, what is an obsession? We need to know what is an obsession. Obsession is defined as a recurrent and intrusive thought that interferes with the individual and enters his mind as an intrusive event rather than with his own voluntary wish. Obsession might also be images, recurrent intrusive images, not only thoughts. And these obsessions, which are intrusive thoughts or images, cause significant distress to the individual because they continue to intrude into his mind without his wish, and it's really uncomfortable.
Obsessive-compulsive and related disorder is an anxiety disorder characterized by intrusive thoughts that produce an uneasiness, apprehension, fear, or worry by repetitive behaviors aimed at reducing the associated anxiety by combination such obsession and behavior.
Signs. People with OCD generally have repeated thoughts or images about many different things, such as fear of germs, dirt or intruders, acts of violence, hurting loved ones, sexual acts, conflicts with religious beliefs, or being overly tidy. Do the same rituals over and over, such as washing hands, locking and unlocking doors, counting, keeping unneeded items, or repeating the same steps again and again. Cannot control the unwanted thoughts and behaviors. Do not get pleasure when performing the behaviors or rituals, but get brief relief from the anxiety the thoughts cause. Spend at least 1 hour a day on the thoughts and rituals which cause the stress and get in the way of daily life. Symptoms may come and go easy over time or get worse if OCD becomes severe. It can keep a person from working or carrying out normal responsibilities at home. People with OCD may try to help themselves by avoiding situations that trigger their obsessions, or they may use alcohol or drugs to calm themselves. OCD can be accompanied by eating disorders, other anxiety disorders, or depression.
The diagnostic criteria of obsessive-compulsive disorder is related to the thoughts and the compulsion behavior. Well, what is the main diagnostic criteria related to obsessive thoughts? We can find a recurrent and persistent thoughts or mental images in patients who are suffering from obsessive-compulsive disorders. Also, the individuals attempts to ignore or suppress such thoughts, but he cannot control himself. Another important thing related to the compulsion behavior, which are related to the diagnostic criteria of obsessive-compulsive disorder, is the repetitive behavior. The repetitive behavior such as hand washing, ordering, or checking, or hoarding, or saving, or praying, or counting, or repeating words, or repeating questions, or accounting some sort of object around him which is not useful at all for him. The behavior or mental acts are aimed to prevent or reduce, but the patient cannot able to reduce this sort of compulsion behavior. Another important thing in the diagnostic criteria of obsessive-compulsive disorder, that the time consuming compulsion behavior, it's not less than 1 hour per day. 1 hour per day, the patient may take at least 1 hour per day for his compulsion behavior.
Obsessive-compulsive disorder is represented by a group of symptoms that include intrusive thoughts, impulses, or images. Such intrusive thoughts, impulses, or images should usually interfere with the normal lifestyle of the client. Actually, it interferes with the client's occupational functions. It interferes with their social activities, and it causes severe distress for clients, and this is the reason why clients usually refer to psychiatric outpatient clinics.
Obsessive-compulsive and related disorder development and course. Do you think that the obsessive-compulsive disorder may occur at the early childhood? Actually, we can note the early sign of obsessive or compulsion behavior in early childhood, specific in playing situation and eating situation in children. We can also find some sort of compulsion behavior or stereotyping behavior in children who are suffering from autism spectrum disorder, or a patient who is suffering from any depressive developmental disorder. We can find also that the child in early childhood phase or even in moderate childhood phase may induce some sort of compulsion behavior in his hand washing or in his way of behaving at classroom or at family home. Another important thing related to the development and course. Perhaps the obsessive compulsive disorder started at the middle adolescent phase during the sexual maturation. We can note the early sign of obsessive or compulsion behavior in early childhood, specific in playing situation and eating situation in children. We can also find some sort of compulsion behavior or stereotyping behavior in children who are suffering from autism spectrum disorder or patient who are suffering from any depressive developmental disorder. We can find also that the child in early childhood phase or even in moderate childhood phase may induce some sort of compulsion behavior in his hand washing or in his way of behaving at classroom or at family home. Another important thing related to the development and course. Perhaps the obsessive compulsive disorder started at the middle adolescent phase during the sexual maturation because there is some sort of the self-hygiene and the sexual maturation. When the patient have a resistant culture or a resistant family system which ordering him all over the time to keep himself every single day in a good figure, in a clean figure, in a good way, in a good hygiene, in high or extreme or perfect hygiene, he may induce a conflict between his feeling of sexual maturation and orgasm from a side and another order or community or religion, tradition and religion order and the family system orders. And this pattern of conflict may induce obsessive compulsive disorder, especially in his self-hygiene and the prayer and even in his way of thinking. Another important thing related to the development and course, we can find that the obsessive compulsive disorder may occur at the early adulthood phase, especially in the way of dealing with people during the academic environment or through his work environment.
To give an example, you may find that somebody or yourself is obsessionally washing your hands. The fear that's triggering that behaviour is that you may have germs on your hands and you may get some kind of physical illness, some kind of disease. So you wash your hands repetitively to get rid of what you think are germs. You wash your hands more than the average person. So what happens is you may turn off the taps, go to leave the bathroom or the washroom, and you begin to doubt yourself whether you have washed your hands properly, or maybe think that there's a small area of your hands you haven't washed, and you go back to the sink and you wash again. Now this can happen more than once, twice, 3 times. You keep going back to the same situation to make sure and to check that you've done the activity that you're obsessing over, or that you feel compelled to do. Where if you don't do it, you start to get anxious and start to doubt yourself. Some other obsessive behaviours can be, I've come across turning a light bulb on and off and not sure whether the light has been turned off or on, and going back continuously to check the light has been turned off and on.
Diagnostic features. The diagnostic features of obsessive compulsive disorders is related to repetitive behavior, such as washing or mental acts, by the way. Another compulsion are typically persistent in patients who are suffering from obsessive compulsive disorder, which is triggered by obsessions and rumination of thoughts and rumination of ideas, negative ideas toward himself or toward people around him, or even toward the future. Perhaps also we can find that there is a correlation between the negative automatic thoughts and the repetitive compulsion behavior or action. May occur a clinical significant pictures such as impairment in his way of thinking and impairment in his way of dealing with situation. We can find also that he focusing on details in very negative way, and obsessing may occur per day around 1 to 3 hours in his thoughts or in his compulsion behavior. The compulsion behavior also have nearly consistent interruptive or intrusive thoughts and the compulsion that can be indicated to an anxiety.
Obsessive compulsive disorder is characterized by recurrent or marked impairment or marked anxiety and depression that is characterized by recurrent obsessions or compulsions or both. This condition is usually a chronic condition. Clients usually complain of inability to resist such obsessions or their motor acts, the compulsions. Yet they do believe that such kind of obsessions or such kind of manifestation of obsessions, which may be thoughts, impulses or images, are not based on any logical grounds.
We can find that the patient who's suffering from OCD has some sort of anxiety. Another thing, he complain from behavior compulsion or compulsion behavior. And another important significant sign and symptoms that he may start to focus on the object several times without any reason. He may also perseverate in focusing in details or telling others around him the details of the situation much more and more, over and over. Also, we can find a specific sign and symptoms related to that he know that he do something wrong, but he cannot prevent himself to do it.
Suggested to be cause of obsessive compulsive disorders. There is also a lot of psychodynamic factors which is implicated in the etiological factors of obsessive compulsive disorders. 18-2. We have certain diagnostic criteria actually for obsessive compulsive disorder according to the diagnostic and statistical manual. There should be either obsessions or compulsions, and as we said, obsessions are usually characterized by preoccupation of certain themes. Compulsions are usually the motor act of such obsessions. So there should be either obsessions or compulsions as the first important diagnostic criteria. Then there should be also other criteria which explain such obsessions and compulsions. For example, it should be considered to be to cause certain distress or tremendous actually distress for clients, and clients should always recognize such obsessions and compulsions as the product of their own minds.
Signs and symptoms of obsessive compulsive and related disorder: repetitive obsession or ideas or urge, fantasies in situations or places, or washing or cleaning, or repetitive behavior as close the door, close car, close, or repetitive of behavior as foot, step, and else. This disturbance, these symptoms and signs disturb and distress these patients in social and occupational function.
Causes. OCD sometimes runs in families, but no one knows for sure why some people have it while others don't. Researchers have found that several parts of the brain are involved in fear and anxiety. By learning more about fear and anxiety in the brain, scientists may be able to create better treatments. Researchers are also looking for ways in which stress and environmental factors may play a role. Studies have also shown that people with OCD have an imbalance of serotonin in their brain. Serotonin is a neurotransmitter that the brain uses to transmit information from one brain cell to another.
The main causes related to obsessive-compulsive disorder or may induce obsessive-compulsive disorders, it's one of them biological factors. Most of the recent studies started to focus about the biological factors and how the increasing of noradrenaline may induce obsessive-compulsion disorder. Another important studies started to focus about the heredity factor and how it's related to the genetic factors, especially in the first generation. Another important studies focusing in the overactivity in the frontal lobe in the brain of the patient who is suffering from obsessive-compulsive disorder in comparison with other control group in normal people. Is there any other causes related or may induce obsessive-compulsive disorder? Actually, yes. There is a psychosocial causes or psychosocial factors may induce obsessive-compulsive disorders. One of them, the modeling or the early modeling in the family. When the patient started to focus about the early modeling related to his parent, and one of them suffering from some sort of compulsion behavior, he started to make an imitation to this compulsion behavior. Perhaps as a child started to see his mother over hand washing, he may start to make the same behavior in a repetitive way, and this pattern of behavior pattern, it's mean a compulsion behavior and may induce at the future obsessive-compulsive disorder or at least obsessive-compulsive personality disorder.
There is a lot of etiological factors for obsessive-compulsive disorders. There is a lot of neurotransmitters in the biological point of view implicated in the pathogenesis of obsessive-compulsive disorders, and actually the serotonin system dysregulation is considered to be the most important biological factor suggested to be cause of obsessive-compulsive disorders. There is also a lot of psychodynamic factors which is implicated in the etiological factors of obsessive-compulsive disorders.
There is an important relationship and significant also relationship between the way of thinking in patient who is suffering from OCD or obsessive-compulsive disorder and the culture of his society. Perhaps the patient may come to the clinic with a clear obsessive thoughts and repetitive thoughts concerning religion, concerning prayer, and this pattern of way of thinking not related at all of the way of prayer or the way of make his worship, and it's related to the way of the society in doing such tradition or such religion tradition at mosques and so on. So that there is a significant relationship between the society and culture from a perspective and the obsessive-compulsive disorder from another perspective.
Certain biological factors actually, or certain biological conditions are considered to be one of the most important differential diagnoses for the cases of obsessive-compulsive disorders.
There is a relationship between gender and obsessive-compulsive disorder. We can find that females or the female gender it may induce obsessive-compulsive disorder, especially at early adolescent stage, more than males in this phase. And perhaps also we can find that the obsessive-compulsive disorder in females may related to some sort of eating disorder and body image, because patient who suffering from anorexia nervosa suffering also from some sort of obsessive thoughts, especially in calories, eating, food, and physical activity.
Let's take, for example, OCD, which involves the hygiene or the infectious diseases. The individual might have an obsession that if he touches a dirty object, that he might be contaminated with certain germs, bacteria or viruses. And these thoughts are irrational, but they continue to intrude into his mind despite him knowing that it is irrational and that this thing that he touched, the glass or whatever, is clean. But the thought continues with him, and because of that he starts to act and with a compulsion in which he goes and washes his hand excessively.
Causes. What is the main causes of obsessive compulsive disorder or OCD? The main causes, it's related to the biological causes or the biological factors, which focusing on the noradrenaline factors or the disturbance in the frontal loop or the neurotransmitters in frontal loop. And this is very important factor. Another thing is that related to the heredity factor, which related to genetic factors. The genetic factors results reported that the OCD may occur about 5 to 7% causing by genetic factors or heredity factors. Another important thing related to the psychological and the psychosocial factors causes. One of the most important thing about sarcophagus and Aaron Beck point of view about the causes of OCD. OCD may induced caused by learning behavior, learning model, that the patient during the early or the middle childhood phase or even during the adolescent phase may observe a negative model of obsessive compulsive disorder in his parent or in his family members, any one of his family members actually, so that he started to make an imitation to this behavior. Perhaps some sort of this behavior is a washing behavior, so that he started to learn how to make a compulsion behavior in washing his body. Or one of this behavior is a confirmation, or to checking, or to saving, or to be aggressive in whether verbally or non-verbally, so that the psychosocial model started to say that the OCD occurred by early modeling factor, early learning factor. And once the child started to note and observe this pattern of negative model, he started to get OCD or induced OCD at the future.
Treatment. Obsessive-compulsive disorder is generally treated with psychotherapy, medication, or both psychotherapy. A type of psychotherapy called cognitive behavior therapy is especially useful for treating OCD. It teaches a person different ways of thinking, behaving, and reacting to situations that help him or her feel less anxious or fearful without having obsessive thoughts or acting compulsively. One type of therapy called exposure and response prevention is especially helpful in reducing compulsive behaviors in OCD. Medication. Doctors also may prescribe medication to help treat OCD. The most commonly prescribed medications for OCD are anti-anxiety medications and antidepressants. Anti-anxiety medications are powerful and there are different types. Many types begin working right away, but they generally should not be taken for long periods. Antidepressants are used to treat depression, but they also particularly helpful for OCD, probably more so than anti-anxiety medications. They may take several weeks, 10 to 12 weeks for some, to start working. Some of these medications may cause side effects such as headache, nausea, or difficulty sleeping. These side effects are usually not a problem for most people, especially if the dose starts off low and is increased slowly over time. Talk to your doctor about any side effects you may have. It's important to know that although antidepressants can be safe and effective for many people, they may be risky for some, especially children, teens, and young adults. A black box, the most serious type of warning that a prescription drug can have, has been added to the labels of antidepressant medications. These labels warn people that antidepressants may cause some people to have suicidal thoughts or make suicide attempts. Anyone taking antidepressants should be monitored closely, especially when they first start treatment with medications. Some people with OCD do better with cognitive behavior therapy, especially exposure and response prevention. Others do better with medication. Still others do best with a combination of the two. Talk with your doctor about the best treatment for you. OCD usually responds well to treatment with certain medications and exposure-based psychotherapy, in which people face situations that may cause fear or anxiety and become less sensitive to them. NIMH is supporting research into new treatment approaches for people whose OCD does not respond well to the usual therapies. Those approaches include combination and augmentation treatments, as well as modern techniques such as deep brain stimulation.
There is a lot of evidences for the management actually of clients with obsessive compulsive disorder. Now, we have two important dimensions when we speak about management of obsessive compulsive disorder. The first one is of course the diagnosis. Then we have to consider the psychological interventions as well as the biological interventions. The biological interventions actually includes a lot of agents, a lot of pharmacological agents. Of importance are the selective serotonin reuptake inhibitors and the older generation of tricyclic antidepressants. Usually such agents are getting certain relief for clients.